The war has disrupted one of the world's busiest shipping lanes, and the global pharmaceutical supply is getting caught in the middle. American and Iranian blockades of the Strait of Hormuz could eventually lead to higher drug prices and shortages. The U.S. gets nearly half of its generic prescriptions from India, which is one of several nations that rely heavily on the strait for medication transport. Indian drug makers also use the waterway for shipments of oil and petroleum-based ingredients to make solvents, coatings, packaging, even the plastic in IV bags and syringes. And the global helium supply is in jeopardy following Iran's attack last month on Qatar's Ras Laffan liquefied natural gas facility. Helium is an essential coolant used in MRI machines. Experts with the Council on Foreign Relations Global Health Program say the conflict could drive up helium prices and reduce supplies since Qatar relies on the Strait of Hormuz to transport gas, which has a short shelf life. CBS News medical contributor Dr. Céline Gounder joins us now. She's also editor-at-large for public health at KFF Health News. So, doctor, how concerned should people be when it comes to this shortage? What's going to be affected?
So we haven't seen shortages yet, but we can anticipate there may be some shortages in a couple months. Half of our generic drugs come from India. And we need oil and petrochemicals, or India needs oil and petrochemicals as a raw ingredient for the development, for the manufacture of many generic drugs. And with the 40% of their drug exports going through the Strait of Hormuz, with much of that traffic having been stopped, we've seen just in March alone a 25% drop in Indian exports of drugs. And so the drugs that are most implicated are high-volume generic drugs, so things like blood pressure medications, statins, which are medications taken for high cholesterol, metformin for diabetes, as well as some common antibiotics like amoxicillin. And then the other group of drugs that's also impacted here are temperature-sensitive drugs. Now, those are usually shipped on planes, but through airports like Dubai, Abu Dhabi, Doha. And those have been shut down. Now, those are coming back online, but the medications that would be implicated there are things like insulin, some cancer chemotherapies, as well as certain vaccines.
Okay, so clinical trials also, those are pretty common in that part of the globe because the chronic diseases that are in the area, also because they can fast track a lot of trials that might have more regulation or red tape here, right?
Yeah, that is right. We do a lot of research overseas for that reason, because you have the right patient population, again, with chronic diseases, as you mentioned, but sometimes there's fewer regulatory hurdles. And so sometimes that's how we go about doing things. It may be cheaper for certain drug companies to do that. I think one thing that's important to emphasize is that even if the shipping lanes were to open tomorrow, it's going to take months to clear the backlog. So logistics companies estimate that for every week of pause in shipping through the Strait of Hormuz, it takes a week and a half to clear that 1 week of backlog. So, you know, if you add up how many weeks we've already had, you're looking at time to relocate containers, reset schedules, stock warehouses. And then on top of that, there's been damage to petrochemical facilities, which are providing the raw materials again. And so that's going to constrain both supply and drive up cost of those raw materials.
So what should people do in the meantime?
So for now, most pharmacies have 30 to 60 days of supply, but talk to your doctor and see if you have an up-to-date prescription and refill.
Dr. Céline Gounder, thank you as always.